People start smoking and continue to smoke for all sorts of reasons. Usually people start when they're young, and it quickly becomes an addiction. What maintains smoking over many years? Well, it's purely that. It's because it's difficult to give up. So people can smoke for 10, 20, 30 years longer than maybe they would like to. Smoking rates are very, very high among people with mental health problems. In fact, we tend to find they're at least double the smoking rate that we find among the general population. We don't really know, to be honest, why that is the case. There are many theories, if you like, that have been put forward. One, of course, quite simply, is the people living with mental health problems smoke because smoking is somehow seen as helping with those mental health problems, maybe somehow helping with stress, helping with anxiety, helping people stay calm. People do say that smoking is good for mental health, but in fact, it's really not. Research study after research study suggests that smoking, if anything, is actually bad for mental health. Smoking is associated with both the onset and worsening of many mental health problems, in particular anxiety, depression. It seems to make matters worse, especially in the long term. The idea that smoking helps with stress, helps with anxiety, yeah, of course, when we see someone lighting up a cigarette, they seem more relaxed, they seem calmer, but really that's just the effects of withdrawal being alleviated for a few minutes by the cigarette. Of course, that withdrawal, the need for a cigarette, isn't there once people have successfully quit. There are so many reasons to consider quitting smoking, and really they're personal to each individual. Obviously, there's the health benefits. Quitting smoking is the single best thing you can do for your health, not just in terms of those long-term illnesses. Of course, you're less likely to end up with cancer, less likely to end up with heart disease, but even within a few weeks of quitting smoking, just general daily fitness improves. Your breathing improves, your energy levels improve. Other people quit smoking for completely different reasons. Many people, for example, maybe especially women, quit smoking because they know of the effects that smoking has on skin, on wrinkles, those more cosmetic reasons. And when someone quits smoking, it really is obvious. They can look 5, 10 years younger, even within a few weeks after quitting smoking. For people with mental health problems, quitting smoking isn't just going to benefit physical health, it's also going to benefit your mental health, especially in the long term. Of course, it's difficult. Psychologically, it's difficult, especially in those first few weeks. But again, studies have shown that issues such as the benefits for people with mental health problems of quitting smoking really are numerous. And it's not just about physical health. Of course, physical health is going to improve, but so is your mental health in many cases. Studies have shown, for example, that within even a few weeks of quitting, anxiety levels improve. People feel more calm, feel on a level. Of course, that process of quitting smoking is psychologically difficult. You have to go through that withdrawal phase. But yes, mental health in particular will benefit more and more the longer you've stopped smoking for. If I was going to give someone advice on quitting smoking, I think most important thing of all is don't do it on your own. There are health professionals out there trained specifically in helping people get off the fags, so why would you want to go and do it on your own? In particular, NHS stop smoking services all around the country. People are at least double, maybe 3 times more likely to quit if they take themselves along to the stop smoking service. And of course, those services are easy to access. All you need to do is ask a member of mental health care or a doctor. They will be able to give you the number for the local stop smoking service. One other reason, I guess, why we see such high rates of smoking among people with mental health problems is because often addressing smoking, thinking about quitting smoking, it's just not seen as an issue for people with mental health problems. If I don't have a mental health problem, there are so many people around who want to help me quit smoking, my doctor, the nurse at the general practice. But if you happen to be living with a mental health problem, that can often go out the window, and suddenly you quitting smoking is somehow seen as not an important issue. Maybe you should even continue to smoke to keep you on a level. And of course, that's nonsense. Quitting smoking, even if you have a mental health problem, is one of the best things you can do for yourself. One thing that's important about people with mental health problems quitting smoking is there's this myth that it's going to be impossible. If you happen to be living with schizophrenia, let's say, you're not going to be able to quit. Let's face it, so don't even try. Again, that's rubbish. The smoking rates, or the quit success rates rather, among people with mental health problems are very comparable to those that we find among the general population. I think sometimes confidence is lower. People's faith in their ability to quit is sometimes lower. But yeah, people with mental health problems can and do every day successfully quit smoking. There are a whole range of treatments to help you quit smoking. If we just think about those treatments that are called pharmacological, the supplements. So the most obvious are the nicotine replacement products. You can get patches, you can get gum, you can get even the nasal spray. These products called nicotine replacement therapies can actually double your chances of quitting. But they're not the only option. There are other medications which you can be prescribed by your doctor, which can again double or even treble your chances of quitting. One such medication is called varenicline or Champix, which has shown very high quit rates in research. We might want to cut that bit out, we'll see. Another thing is, one important thing about quitting smoking though, one thing we must always remember is it takes willpower. It doesn't matter whether you cover yourself in patches, whether you take 50, 60 pieces of gum in a day. It won't matter. You have to put in a lot of yourself. You have to be able to say no to yourself. We read a lot about the different ways of quitting smoking, all sorts of self-help manuals, the bookshops are full of them. But really, if you can want a cigarette, really want one, but still not have one, then you can quit smoking. You have to be tough, you have to be strong, and you have to be determined. Nicotine replacement products actually include what is often called the inhalator. It's like a little plastic cigarette. It's filled with nicotine. Inside there's a nicotine cartridge, but it's really good for that hand-to-mouth action that many smokers miss, which is understandable. If you've been doing something for 15, 20 years, maybe 20 times a day, you're going to miss that hand-to-mouth action when you quit, so they can be quite useful. The biggest myth about quitting smoking among people with mental health problems is that they can't. Somehow the people living with a mental health condition aren't able to quit smoking, that it'll be too difficult for them. It's too late for that, really. There are too many people living with serious mental illnesses who have successfully quit smoking. In research, we see comparable quit success rates among programs including people with mental health problems as we do among programs with the general population. Sometimes, people with a mental health condition can understandably lack confidence in their ability to quit. But actually, it's very possible, very doable, and people quit smoking with a mental illness every single day. I guess the thing that really got me into this area of work, the thing that really made me dedicate my career to it, was something that happened some years ago. I was working with a patient in Roehampton. I'd actually met her on an acute psychiatric ward. She'd heard me talking to the patients about smoking on the ward and said, "Can I join in, please? I'm being discharged in a couple of weeks' time. I'd like to quit smoking." This lady's story was that she had 3 months earlier tried to kill herself. She jumped off a multi-storey car park, obviously hadn't managed to kill herself, but had hurt herself very badly, hurt her back, hurt her legs. Anyway, I went to visit her at home. I took the nicotine replacement therapy. I sat with her, helped her think about quitting smoking, and after a few weeks, she managed it. She quit smoking. And I'll never forget going to her house for one of her sessions about a week after she quit. And she blew into the carbon monoxide monitor, which is what we use to show people how their health has improved after quitting smoking, because they can see there's a lot less carbon monoxide in their system. She blew into the monitor and she could see how the reading had gone from a very high level when she was still smoking to a low level, to a non-smoker's level. She looked at the reading and shouted out, "Yes!" at the top of her voice. And then she started to cry. She started to get quite emotional. And I asked her, what's on your mind? Do you want to share it with me? And she just said, "Lisa, I'm fine. It's just that that's the first time I've felt like going yes in about 20 years. And that's when it really clicked in my mind that if you're living with a serious mental illness and you manage to quit smoking, it's not just about helping your lungs or helping your heart. It's about getting a big chunk of self-esteem and putting it right back where it should be. And from there, all sorts of positive changes can start to happen.